Well, hello everyone. My name is Alex Bernardi. I'd like to welcome you to today's webinar, Meaningful Stakeholder Engagement, a collaborative approach to programs for people with intellectual and developmental disabilities and their families. My name is Alex Bernardi. I'm waiting just a few more seconds before we move to the next slide, as we see there are a number of participants who are continuing to join and become connected in the webinar. Next slide, please. So welcome everyone. We will begin with a few logistics. Thank you for joining us to learn about meaningful stakeholder engagement. This is a webinar with a focus on a program for people with intellectual and developmental disabilities. But I do want to say that while this webinar is focused on an IDD system, the presenters certainly are including considerations for other systems and populations as well throughout. This webinar is sponsored by the National Center on Advancing Person-Centered Practices and Systems. We call this NCAPS. NCAPS is funded by the Administration for Community Living and the Centers for Medicare and Medicaid Services. These webinars are produced on a monthly basis, and they are free and open to the public. My name is Alex Bernardi. I am one of the co-directors of NCAPS at Human Services Research Institute, and Dr. Bevan Croft is also joining us on the webinar and will be joining us later, the other co-director at HSRI. Next slide, please. So the goal of NCAPS, overarching, is to promote systems change that makes person-centered principles not just an aspiration, but a reality in the lives of people across the lifespan. And in that, most of the work of NCAPS is working with state systems, states, tribes, and territories to address and advance efforts to make principles and systems and person-centered thinking a component of supports for all people who receive services. With that, I'd like to just touch on a few webinar logistics for the purposes of this webinar. Participants will be muted throughout the webinar, and you can use the chat feature in Zoom to post questions and also to communicate with the hosts. You'll note that there are, if you are using the Zoom platform, at the bottom there is a chat box. There's also a Q&A box. I'd like to encourage everyone to try and use the chat feature, which is where most of the communication will be happening. You can enter your questions there. Toward the end of our webinar, our speakers will have an opportunity to respond to questions that you've entered into chat. So please go ahead and enter questions as you think of them. This webinar is live captioned in English. You can access the English closed captioning through the closed caption box in the Zoom platform. And it is also live captioned in Spanish. To access the Spanish captions, please use the link that is included on the screen here and enter that into your browser for the live Spanish captioning. This live webinar does include a poll and evaluation questions. For those of you joining by computer, please be prepared to interact when we get to the poll questions. Next slide, please. For your information, after the webinar, you can send any follow-up questions that you've not managed to enter into chat to the address on your screen, ncapps@hsri.org. Please note this email address isn't monitored during this webinar, so to the extent possible, if you have questions, technical questions as well, they can be entered into chat. This recorded webinar, along with a PDF version of the slides and a plain language summary, will also be available within 2 weeks on the NCAPS website. That's ncapps.acl.gov. We'll be including questions and responses in those materials that are posted following the webinar. At this point, I would like to bring up our first poll question, which is to learn from you about who's participating on the webinar. this is helpful for our speakers as they move through. So to respond to the poll, please go ahead and click on what roles you self-identify as. And this will help the speakers know really who is joining. We'll leave the poll question open for another 10 seconds or so. And now could we close the poll, please, Connor, and we'll be able to see the results. So we see that the largest portion of respondents is people who say that they represent government, federal, state, or municipal employees. We also have quite a number of people also who are answering who say that they are clinical folks in terms of being a social worker, counselor, or a care manager. And we've got representation from people who use long-term supports and services, self-advocates, and some representation from HMO or managed care organizations. So, so thank you. Okay, we will close that. And with that, I'm going to move to introduce our speakers. So the next slide, please. We have a number of terrific speakers who have agreed to participate today, and so quickly I'm going to go through and introduce each of the speakers and then turn it over to the speakers. To begin with, Eric Wilson, a self-advocate who has been participating in his community and workplace in Tennessee for quite many years, has participated in the planning for this, but at the last minute, Eric wasn't able to join, so we're sorry to know that Eric can't join, but we do want to thank him for his participation in planning for this. Next, Gina Wilson is the director of the Early Learning Program at WAVES, Inc., which serves children from birth to 3 years who have a disability or developmental delay. She's been an advocate for 33 years, focusing on inclusion and empowerment. And finally on this slide, we have Clancy Hopper, who is a resident of Tennessee and moved as a young adult for Project Opportunity, preparing her for many successful jobs, including serving as a tour guide at Nashville's Grand Ole Opry. Clancy serves on the Tennessee Council on Developmental Disabilities, the Board of Directors for Prospect, Inc., and the Board of Trustees for the National Williams Syndrome Association. Next slide, please. We will also be joined by Patty Killingsworth, the Assistant Commissioner and Chief of Long-Term Supports and Services for TennCare. She's worked in Medicaid for 2 decades, leading systems redesign in multiple states. Wanda Willis also joins us, the Executive Director of the Tennessee Council on Developmental Disabilities. The Council is a state agency which was established to improve disability policies and practice, educate policymakers and the public, and facilitate community collaboration to create lasting positive change for Tennesseans with disabilities and their families. Next, we're joined by Jordan Allen, the Deputy Commissioner of Program Operations for the Tennessee Department of Intellectual and Developmental Disability. Jordan's career experience spans nearly 25 years in multiple state service delivery systems. And we are also joined by Stephanie Gibbs, the Director of Systems Transformation and Innovation for TennCare. We have a really incredibly impressive slate of presenters. And with that, I would like to turn it over to, I believe it's Patty, who will be taking the next set of slides and carry on with the conversation. It looks to me like Patty might be on mute, and I just want to check to see whether we can change that from our perspective.
Let's try this. Is that working better?
It is.
I'm so sorry. I apologize. I was just saying how much I appreciate ACL and the work of NCAPS, and particularly our colleagues at HSRI, for bringing this important topic forward today. I think there are a few topics that are more important for us to talk about in the context of how we do this work. As a parent and as an advocate, as well as a state official, it's really my honor to be able to talk with you about something that's been a core focus of my career in state government for the past 2 decades, which is making sure that the voice of those we serve, their families, and our other stakeholders is brought to bear as we develop and implement programs and as we set and change policies to better meet their needs and help them live the lives that they want to live. Today we're going to talk about our efforts to do that in Tennessee as a part of developing a new program for people with intellectual and developmental disabilities called Employment and Community First Choices. So if you'll turn to the next slide. This particular program is for people with intellectual and developmental disabilities, but really important to understand that as we move through this discussion, this could be any program that serves any population, and the critical importance of stakeholder engagement would be the same. More recently, we've used many of the same strategies that we'll talk about today in developing a new Katie Beckett program for children with complex medical needs and disabilities. But to set the stage, I want to begin by just giving you a little bit of information about Employment and Community First Choices, and then we'll walk backward with some of our partners to how the program was developed in partnership with our state IDD agency, our Council on Developmental Disabilities, and the people we serve and their families. Tennessee may be unique among states in that our advocacy community actually approached us about developing a managed long-term services and supports program, specifically a home and community-based services program for people with intellectual and developmental disabilities. I think because they saw an opportunity to design a program that could help provide services more cost effectively while also helping us strive toward valued outcomes that we share, which are really integrated competitive employment, independent living, and certainly person-centered practices that support self-determination for all individuals with intellectual and developmental disability. So the program that we'll talk about really represents their vision, their values, their perspectives about what people with intellectual and developmental disabilities and their families most want and need. At the foundation of that is person-centered planning, where discussions about employment aren't optional or an afterthought, but are really front and center as a part of the person-centered planning process, seeking to help people really think about employment as possible and to understand as much as we can about the kind of work each person might enjoy and be successful at. In the program, there is an array of 14 different employment services, which are literally designed to meet each person wherever they are and help them move along that pathway toward competitive integrated employment, no matter how significant their disabilities. And then that is wrapped by a pretty comprehensive array of flexible, supportive services, which include things that are specifically tailored to help people develop their self-advocacy skills, benefits that are specifically tailored to support families who are helping to support a loved one, and then self-directed options, which give people as much control and flexibility as they want, but all of that really designed to support active community participation and as much independence as people can achieve. Turning to the next slide, the program really does serve the full array of people with intellectual and developmental disabilities of all ages across the lifespan, and really no matter their living arrangement. So whether they are living with family, whether they're living in their own home, or whether they may be in need of assistance in order to live more independently, the program is available to help serve them. Turning to the next slide, which is really about program design, we wanted to do everything that we could to align incentives towards the outcomes that people said were most important for them. And so that's everything from prioritizing people who need support in order to work for enrollment into the program, to an employment-informed choice process that we walk people through to make sure that employment really is the first option that is considered for people, that they really understand what it might mean to work and have an opportunity to explore that before non-employment services are provided. There's also incentives aligned by offering more benefits to an individual who's either engaged in competitive integrated employment or on that pathway. And then finally, by aligning payment for employment services with the specific outcomes that we expect those services will support people to achieve. Turning to the next slide, I think through aligning those incentives, we've learned some really important things. And one of the most important things I think we have learned is that most people with intellectual and developmental disabilities, and I think most people with disabilities broadly, really do want to work, and their families are supportive of that work when they have an opportunity to learn about the work that might be available to them, to understand the strengths and skills that they bring to the workplace, to really understand the array of supports that are available to help them in that process, and then a chance to voice whatever concerns or questions they have and to have those addressed. As we've implemented our employment-informed choice process, starting out with people who either didn't believe they wanted to work or who weren't sure they wanted to work, what we've seen is more than 70% of people walking out on the other side of that process saying, yes, I really do think I want to pursue competitive integrated employment after really having an opportunity to understand what that means. And that's why I think we've been able to achieve the outcomes that you see on the next slide. Keeping in mind that this is still a pretty new program and we are constantly enrolling new people, so we always have people who haven't been in the program for very long. Right now, over 27% of our working age program participants are working in competitive integrated employment. That's about 70% higher than the national average for the same population. Average wages are well above the minimum wage at around $9 an hour. People working not as many hours yet as they might hope, but approaching 20 hours a week, and people who aren't yet working, most of them having a goal to actually pursue that competitive integrated employment. We're certainly happy to talk about the progress that we've made, and we believe that we've been able to achieve what we've achieved so far through this collaborative process, both with our state IDD partners, with our council partners, and particularly by engaging people who receive services and their families very early on in that process. And importantly, by having a really strong foundation to build on, work that was really begun by our state IDD agency and our DD council, which have been critical to really laying the groundwork for these outcomes. And so at that, I want to turn it over to Jordan Allen and to Wanda Willis to really talk about some of that history.
Thanks, Patty. This is Jordan Allen. Patty has already given us a really great overview of the design of the Employment and Community First Choices program. I think it's probably important for perspective to talk a little bit about where services were at the time or the inception of the conversations and collaboration that took place, ultimately leading to the ECF program. So previous to the ECF program, here in the state of Tennessee, services were provided to folks with ID and DD through the waiver program in 3 separate 1915C waivers. We had a statewide waiver, a comprehensive aggregate capped waiver where there was no individual cost cap, and then we had a self-determination waiver, still have a self-determination waiver with a much lower individual cap of $30,000. Those services ran for a couple of decades, and one of the unique positions that we found ourselves in as we were thinking about how to develop programming and bring it in line with our internal expectations, the expectations of stakeholders here in the state, and certainly the national conversation around employment first and person-centered planning, was the fact that we were involved in a couple decades of litigation. So as the results of those litigation began to kind of manifest throughout our waiver programs, as one would assume, we found ourselves adhering much more to kind of a compliance-based regulatory environment that was sometimes at direct contradiction with some of the progressive values that we all agreed were important, programming and regulatory environment to be intertwined within the system. Ultimately, we were able to mediate out of those lawsuits. We were able to develop an exit plan, and finally, in 2014 and into early 2015, we were able to exit those lawsuits. I feel like it's important to reference those, though, because all of the conversations that we had with the council and with TennCare, the state Medicaid agency, and advocates throughout our community were around what we wanted to be able to do at the point at which we were free of that kind of litigation culture that had developed within our waivers. I did fail to mention that we also operate intermediate care facilities across the state, both private and public. The state itself operates 148 of those beds. So we were covering, from a system perspective, we covered even at the inception of ECF, folks who had extreme medical fragility, folks that had a greater level of behavioral treatment needs in community settings, and then folks who were pushed along the path of self-determination in a smaller waiver. Next slide, please. So as those conversations began to develop, we certainly, for the better part of a decade, we had been working in person-centered practices to each of our HCBS service systems, each of the waivers, certainly doing all that we could to present on person-centered planning and the values that are the underpinnings of a person-centered approach to services in general. But as I referenced before, we were somewhat limited in our ability to actually amend policy within the existing waivers by virtue of our involvement in litigation I referenced before. We developed and offered or began offering to agencies within the 1915C network the opportunity to become person-centered organizations, for instance. We made available both the training and the actual materials, person-centered thinking tools, and then to the best of our ability, we ensured that we could support the operationalizing of those practices and tools, even including and up to attending circle meetings if requested to help facilitate that dialogue and ensure that people were being given the opportunity, one, to design, control, and ensure that they had stake in the implementation of their services, but also really at a more organizational level to make sure that all persons working for the state, persons involved in the setting up or the facilitation of those meetings understood the position from which we needed those meetings to take place and made sure that family members, circle of support members, and most importantly, people supported understood their ability to have meaningful dialogue and ultimately stake in how their services looked. We were the first state to seek and then achieve accreditation, network accreditation through the Council on Quality Leadership, and we have maintained that accreditation to today. Of great influence in that process, as Patty mentioned earlier, are certainly the Council on Developmental Disabilities and other stakeholders across the network, but Wanda Willis particularly certainly has left her mark on that system. I will turn it over to Wanda for the next slide.
Thank you, Jordan. It's a pleasure to be here today. One thing that I love about working in the state of Tennessee is the level of collaboration and coordination that we do have. There's just a sense of real joined and shared mission, I think, for all of us working in state agencies and the people that, families and people that we work with. So that just creates a lot of energy and momentum. And I wanted to talk today about one particular initiative where we came together quite a few years ago. In fact, in 2007, the council was interested in the state kind of drilling down on the whole person-centered systems concept. So what we did is we led an initiative with the State Developmental Disabilities Agency, and the purpose was actually to create organizational and systems change that was strongly rooted in person-centered practices. So we had several goals for that, and among those were just basically creating excellent person-centered practices at the provider and recipient level. You know, we all know we talk about being person-centered, but we really wanted to look at what we were doing to really make that happen, to have a real impact on the people's lives who were being served. Another goal was facilitating policy and practice changes at the provider level. So trying to look at ways that those providers could kind of take control and ownership for becoming more person-centered in the work they do every day. And then finally, facilitating policy and practice changes at the state level, because we all know that there's, at the end of the day, sometimes there are state policies, rules, legislation that we feel unintentionally get in the way of us doing the best we can do for the people that receive services, particularly what we would call person-centered services. So I think one of the biggest contributors to the success of this project is that we had the commitment of the Assistant Commissioner for the DD agency at the time, and so I worked directly with that person and making sure that we had a commitment at the highest level. The project required participation at monthly meetings of everyone from this Assistant Commissioner, including his senior policy staff, to provider agency administrative staff, direct support professionals, and then also the individuals that were receiving services. So we had these multiple levels of people that needed to participate in these monthly meetings that were being sponsored by our vendor in the project. So because we had this level of commitment, we were able to, I think, very successfully pull this off in a way that affected change at the provider agency level, but also at the state level as well. The initiative that and the vendor that we were using promoted very intentionally promoted changes that you know, went from the direct support professional, the person participating in their plan, to the agency and their management staff, all the way up to senior staff in the state agency, and even affecting regulations in the state. So by the end of the project, providers volunteered to participate in the project, and by the end we had 13 statewide providers that participated. The people who were in charge of writing support plans received very specific training on how good plans could be written, and they learned to discriminate between what was important to the people being served and what was important for the person being served. One thing personally I loved about this project is that agency staff were given very easy to use tools, very simple tools to understand, and guides that help them really get to the individual being served and what was important to them. So we had 100% of all management teams, including regional office directors for the state, state office senior staff, direct support professionals, independent support coordinators, families, and people receiving services participated. And with that, I think it's important to note that one of the most significant outcomes that was so evident was the increased communication among everybody. You know, in the system that you all work, it's amazing how much we don't know about what our partners, even sometimes in the same agency, are doing. And so the beautiful thing about this initiative is that we learned to very intentionally communicate with each other about plans and barriers to plans that people wanted to accomplish. So when the project ended, we made a real effort in the state to have our own core of person-centered thinking trainers. So we wanted to be able to carry this forward, to make the tools and processes in the project sustainable, be around for a long time. As a result, we had 20 credentialed person-centered thinking trainers. And these trainers are in place today. They provide monthly person-centered training, the basic principles of person-centered thinking and planning, the tools that are useful to use in each region of the state. We also had 4 credentialed mentor trainers. Those mentor trainers, you may be familiar with Michael Small and Associates. They're credentialed by that group to provide sort of a step beyond person-centered thinking into person-centered organization training to the agency. So therefore, they can provide technical assistance to the agency. They can facilitate coaches groups and leadership teams within the agency, and they can help to facilitate higher level changes, not just within the agency, but also throughout the system. So just to mention, one of the most significant high-level changes in the state was the creation of a new and more efficient, effective format for support plans. You know, sometimes the processes and forms that we create can end up being barriers to us accomplishing, or a person accomplishing, what they would like to accomplish for themselves. So this was real important to be able to look back at the plans that we were using in the state and make them a little more effective and efficient for person-centered services. The other thing I will mention is that, and one of my favorite accomplishments of this entire initiative was the creation of the People Planning Together project. And this project offers classes that are taught by people who receive services to other people receiving services in our system on how to develop their own life goals, what's important to them, and then how to take that forward and be an active participant in developing their support plan. It's a very popular program that goes on today. The council continues to provide travel costs for the people who do the training. We provide consulting fees to the people who do the training. So we have 13 credentialed trainers in this People Planning Together program across the state. So I'll stop there and move on to...
I think I got the next one, Wanda.
Jordan. To Jordan. Thank you.
Thanks, Wanda. I want to talk about, I guess, what we've heard already, and certainly what would be intuitive is with all of this coordination, as Wanda just referenced, having an opportunity to work in a system where there's buy-in, widespread buy-in across the entire stakeholder community, we pretty quickly started thinking about continuity and sustainability. And now that we've provided this training, and now that there's an understanding as to how impactful this is, what can we do at a state level to ensure that we're embedding this throughout all of the planning and support service systems, regulations, expectations, and even within state offices. So to that end, some of the things that we put in place very quickly after we realized this had really taken hold and was having impact, were to create a person-centered office within DIDD, the state DD office, as Wanda referenced. And so we have a state director and person-centered practice units in each of our regional offices across the state. And so we're in 3 grand regions here in the state of Tennessee, but we have 5 total offices. And one of our goals was to ensure that we had a trained consultant / expert available to anybody, whether that be in the metropolitan cities like Nashville or Memphis, or in some of the more rural areas like Greenville. And so we hired staff and got them in place and ready for deployment upon request. We also increased the number of state-level person-centered thinking trainers and mentor trainers and added those to the roster, and embedded person-centered practices into all of our operational policies. And so at one point, we sat down and things as small as ensuring that all of the words throughout our entire manual, our provider manual, which at one point literally was hundreds of pages long, to every operational policy, every guidance document, we went back and reviewed all of that to make sure that that language was in concert with expectations and certainly folded in nicely to the person-centered planning approach that we were employing at each individual ISP meeting and any circle meetings that sought to amend services. Providers were actively recruited to take part in person-centered thinking training, and we did that. Although we didn't have to offer much incentive, frequently we found ourselves in a position, even with all the staff that we had hired and the infrastructure that we had built, developing a bit of a waiting list for providers as they requested that. But we did as much of that person-centered thinking training as possible, and then moved on to person-centered organization training with other agencies, which was actually a 10-month commitment, and there were monthly training sessions and meeting requirements, all the way including and up to the executive level folks at each of those agencies. And again, I think the most important component when I talk about that is the fact that not only did we offer it, but it was our provider community as a whole. We ended up having to do a score-based process to choose agencies that we would deploy our staff to, because so many of the agencies through our network wanted to become person-centered organizations. That training remains current today, and we knock them out as fast and efficiently as possible. And in a perfect world, we could hire double the number of staff that we have to do those trainings, but we are still getting requests. As soon as one finishes, we start another one. The Office of Person-Centered Practices has developed a one-page profile system that can be distributed and is being implemented season-wide, or system-wide, I'm sorry. The one-page profile really is a concept and a specific template that helps provide kind of an at-a-glance knowing of what really matters to people. So I'm sure, as is consistent with state systems across the country, people do move in and out of different services. And in fact, services have been developed, and the Employment and Community First Choices program is a great example of that, but we're hoping to push people along a continuum of services that will meet folks where they are in their desire to become employed or desire to gain greater levels of independence, and whether that means community membership or less staff or whatever it is. The goal is to have people engage in a service and, for lack of a better term, get all they can or complete that service and move right into a continuum of services that meets them at their new station until they eventually reach the level of independence or employment or whatever it is. We like to joke here that if we've done our job right, we no longer have a job. And while we haven't achieved that yet, we certainly have seen fairly significant movement through the system. So this one-page profile can travel with people as they leave a service. If there's an agency that they would choose to provide the next of those services, whether they be employment services or residential services, this one-page profile really helps travel with them in a really portable way and has been an effective way to kind of ease that move between services and different providers or programs. That one-pager captures really important information, obviously on that single sheet, and focuses really on just 3 simple headings. What do people appreciate about me? What's important to me? And how can you best support me in my stated outcomes or my desired goals? We found that profile, I should say, to be a great foundation for person-centered planning, and certainly has led to positive change for people. With that, I'll turn it back over to Patty to talk a little bit more about employment and community first choices, again, taking a step back around 2016.
Thank you so much, Wanda and Jordan. I'm going to have you forward. There we go. Because what you can see from hearing both Wanda and Jordan speak is how strong a foundation had really been laid for the successful design and launch of employment and community first choices. Moving to the next slide, the answer, I think, to a big question that people had going into the program, one more slide, was, can a managed care program really be person-centered? Can we move into managed care and maintain this person-centered approach and person-centered values that are really critical to us and that we've been working on for so many of these years? And the answer to that question is yes, but it doesn't happen automatically. So turning to the next slide, then the question became, how do we move forward into a new world, if you will, a new program, and take with us all that we've learned and embed these important values within this new service delivery system. So there were a number of different initiatives that we included to make sure that we were advancing that work in the new program. The most important initiative was really about engaging and listening to people served, to family members, to advocates, to providers, really understanding the things that they wanted, the things that they believed were needed as a part of the program designed to ensure that it remained consistent with this value base that we had. Certainly our partnership with our state IDD agency was critical. They really brought such tremendous capacity and expertise around person-centered practices, and we wanted to be able to leverage that and share that in the new managed care program. Wanda already spoke about, and they were critical partners with us in engaging outside experts as well. The work that Support Development Associates did with us, with the System Transformation Group that Stephanie will talk about shortly, with our health plans, became a really important part of building health plan capacity for person-centered practices. Moving to the next slide, remembering again that stakeholder engagement early in the process and then ongoing was really essential to making sure that the program that we were building was responsive to the needs of people with disabilities and to their families. And they were very clear about the things that they wanted in the new program, things that were both about the cost effectiveness of the program so that more people could be served, but also about the outcomes in the program, really being able to support people in achieving employment, to support people in having meaningful days, to support people in gaining as much independence as possible, all the way through, and importantly, helping to build a consistent, well-trained, quality workforce to support people in the new program. Now I want to turn it over to Stephanie to have a conversation with Gina about some of her experiences. We're sorry that Eric can't be with us, but I think her perspective will be particularly insightful as we talk about the rollout of the program.
Patty, thank you so much. So you mentioned the importance of stakeholder engagement, and we're so excited to have Gina Wilson with us today. And Gina, please extend our best to Eric. We're sorry that he's not feeling well today. But we're really excited to have you join us and to share your perspective, which I think is a really unique perspective, not only as a family advocate, but also as a part of the provider community. So I'll invite you to tell yourself a little, or tell the group a little bit more about yourself, especially your relationship to employment and community first choices.
Okay, so I've been at Waves for 12 and a half years. but I've always been in the birth to 3 program and never in the adult program. But because of my son, Eric, I was always, of course, involved in anything that was going on. So whenever the person-centered training started here, of course, I was in on it, even though I was in early childhood. I had a personal reason to learn everything that I could about it. I think whenever ECF did drop, we were one of the first ones to go through, because my husband and I needed some support with Eric, with both of us working full time. Eric had already gotten a successful placement, mostly because of brute force at a Publix 10 years ago. So we got him involved, got him a good job at Publix, which he still has, but now ECF is the reason that I can continue my job. I could not be here if it weren't for those supportive services. He only receives 12 hours a week. That's enough to get us through, and transportation.
Great. So, Tina, tell us a little bit more about Eric and his position with Publix. So what have you experienced in his personal growth or just fulfillment in relationship to the position he holds there?
Okay, he is not the same person he was before this job. I live in a little subdivision in Franklin, and Publix is kind of like a neighborhood grocery store. And as he was graduating from high school, we were given several choices on where he could be employed, and none of them were on my list. I didn't want him somewhere. I mean, there was nothing wrong with any of these choices that they made for us, but I wanted him near me. I wanted him near my home, and I wanted him out and about. I didn't want him, you know, doing some piecework in the back room or anything like that. I know that wouldn't have been successful. And so I talked to Publix from the time they opened those doors. I don't even think he was in high school yet. Just kind of said, he's coming, he's almost ready to graduate, and then you get him as a bagger. And it just kind of worked out for us. He ended up getting the job right after finishing transitions 2 at Franklin High School. And it was really slow at first. He needed a lot of support. He ended up getting some coaching through VR that kind of helped him through. And now he's been there 10 and a half years. And he is really, he is an important part of our community. I can't go anywhere without people stopping me and talking to him. And a lot of times he and this person I don't know will have this long conversation, and that's how they know him. That's the first time that he's really had, you know, these relationships outside of our family. And that probably means more than anything. He went from working 3 hours of what was torture for me, and now he's working about 20 hours a week without any issue at all.
Oh, that's wonderful to hear, Gina. Thank you for sharing that update. So let me shift now and have you tell us a little bit more about the early conversations on employment and community first choices. And I believe Alex and Devin can keep me honest here, but I think this is a part of our conversation we were asking our audience to perhaps share their experiences in the chat box as well. So if you have a different experience than what Gina is sharing, or maybe some common themes are emerging with what you've experienced, that would be something that we'd be interested to hear. And I believe, time permitting, we're going to circle back to that during question and answer. So Gina, tell us a little bit more about how families and self-advocates participated in those early conversations about employment and community first choices.
To be honest, whenever I started doing some of the training here and hearing about it, I thought it was too good to be true. And it was an answer for my family. And And then whenever Waves was chosen as a provider, I just felt like I was in the right place at the right time. So not only did I understand what ECF was about, I also worked with the people. I'm very controlling over Eric. I admit it. I know that I am, and I have a hard time letting him go with others. But the folks that he would be spending his time with worked in the office next to me, and that was very comforting to me. And that I think I had an advantage there that a lot of other folks didn't. But once they saw that we did that, a lot of people followed in our footsteps. So the very first feeling, I guess, that I have about ECF is that, what's the catch? I mean, to be honest, I didn't think that it would be as good as it was for our family, but it has been.
Wonderful. So in the interest of time, let me skip around a little bit, and let me ask you, in those early conversations about employment and community first choices, as you're providing feedback to the state agencies that are represented here today, and perhaps even having conversations with self-advocates or other family members, how did you know that your feedback was being valued and used in a meaningful way to really advance program development? How did the state agencies really demonstrate that to you?
Do you mean Waves specifically, or DIDS and?
Just your experience as a family member, as you were providing feedback and really talking about, you mentioned employment and community first choices. You didn't know if it was actually too good to be true. Tell us a little bit more about how the state was kind of demonstrating to you that feedback, your feedback and your perspective is being used in a way to take what was important to you and make sure that that was a part of these programs.
We had a service coordinator who was very detailed, and she was amazing. We went through, actually we asked for one thing and we ended up changing that along the way several times, like balancing out the services. We needed more of this and less of this. And for me, every time I made a request, it was granted. So I don't know if my requests were really small or what, but to be honest, we started off to asking for more services than we needed. And so we had many more hours of support to begin with. And then when we felt like we just didn't need that much, then our service coordinator was quick to, let us know, well, you can reduce this and up this. And so I felt like I was always in control of the support that we received.
Great. So let me skip to the last question then, Dare. What advice would you give to other states or organizations who may be listening today on engaging stakeholders like self-advocates like Eric, and also you as a family member advocate?
Well, I am, one of my goals too is to let other parents know that, the parents need to play a part in this. Sometimes what I've seen with other folks is it's just like, okay, he's your problem now, or, the parents need to be more active, I feel like, including myself. The advice I would give other states is to make sure that's fully funded, because I can see both sides of this. I see the supports that my son gets, and I also see how Waves struggles to cover everything.
Okay. Well, Gina, thank you so much for sharing your perspective. Is there anything else you would share with this group before we move on?
No, just that I'm really thankful. It's made a difference for my son and for my husband and me.
Wonderful. Thank you so much, Gina. All right, so we're going to move to the next slide now. And just in the interest of time, I hope the group will indulge me in letting me go pretty quickly through these slides and just hitting some of the high points, so we make sure that we absolutely leave time for Clancy Hopper, who is going to share her perspective towards the end of our presentation today. So again, Gina, thank you so much. I believe your insights have given us a good launching point to discuss some of the ways that stakeholder feedback and engagement has shaped the direction of employment and community first choices. So one initiative that we'll mention is our focus on culture and system transformation. The goal of our system transformation work is to align our long-term services and supports programs with policies and programs that are person-centered and uphold those person-centered philosophies. So stakeholder engagement is key to this work. We convened a statewide system transformation leadership group with representation from across the LTSS delivery system, ensuring diverse perspectives were at the table. We asked this group to develop a strategic plan and prioritize activities that would have the most impact on this transformative work. I've noted a few guiding thoughts here on this slide, namely shifting our focus from a compliance focus to advancing quality, including improving the quality of lives for people taking part in LTSS programs. But this would also include incentivizing providers for quality outcomes, not just meeting the compliance requirements. This also includes making the commitment to use data in a meaningful way to inform changes, and that might include reports or other data points, but also the feedback that we get from our stakeholders through surveys or more informal channels as well. And talking about system transformation provides a really important opportunity for us to highlight the applicability of this work across our programs and the populations that we serve. So our preparation for the launch of Employment and Community First Choices provides an opportunity for us to think really holistically about the system, the delivery system, all the players in the delivery system, and how to advance person-centered planning and practices across the system, which would include our 1915C waivers that Jordan mentioned, but also our Choices program, which serves people over 65, as well as people 21 and older with a physical disability. And let's move on to the next one. Oh, we are on the next slide. Thank you. Thank you. So just briefly highlighting the themes that we heard earlier in our presentation today, building on a strong foundation, leveraging partnerships with other agencies to advance person-centered practices. The DD Council was and continues to be a key partner for us. Here are some of the initiatives we engaged in early on to advance person-centered approaches to employment and community first choices. Just highlighting several collaborative partnerships here with the Council, including person-centered thinking for all of our support coordinators, which are part of our managed care organization teams, prior to the program going live, and also providing expertise on policies, procedures, hiring practices to ensure managed care organizations were fully supported in upholding person-centered practices. So we did a lot of work in building capacity within our managed care organization partnerships to ensure that, again, across the delivery system, we were ready to launch the program and we're considering person-centered practices and thinking all along the way. Moving to the next slide, we heard from families that a quality, well-trained workforce is essential to home and community-based services, and also really key to the experience that people and families have with the program. So we're noting here our work with QUILTS, which stands for Quality Improvement in Long-Term Services and Supports. It's a value-based purchasing initiative. It's led by TennCare, but has been really a collaborative process across our stakeholder community to promote the delivery of a high-quality long-term services and supports program, focusing on those measures that are most important to people who receive long-term services and supports. One key initiative, QUILTS, is to address the direct support workforce shortage crisis by providing training and career paths for direct support workers. Related to our topic for today's webinar, we wanted to share that the training, really wanted to point this out, call this out specifically, does include modules dedicated to person-centered practices, community inclusion, empowerment, and advocacy. There's a focus on direct support workers who are just entering the workforce to ensure that they're supported and that they understand principles of person-centered thinking and practices early in their work. There's also a focus on dementia training, which is, again, thinking across the populations that we serve, and also an upcoming training dedicated to self-direction of healthcare tasks. And as we've noted on the slide there, this training is built on those 12 core competencies that were shared by CMS. So again, just ensuring that partnership with national partners as well. Going to the next slide. We also heard from families that better coordination between services is a need, as well as opportunities to empower the person and families in the planning process. So we'll note that one key way that we've addressed this feedback from stakeholders, every person in the Employment and Community First Choices program has a person-centered support plan, or a PCSP, as we say. So the PCSP captures services and supports, including specialty services that may be needed and community resources, but also captures the vision a person has for his or her life. It builds on strengths and preferences. It's directed by the person, and we want to ensure that it contributes to the person's growth as well. So moving to the next slide. So related to the idea of providing support for people and families and in their navigating the system, every person in the Employment and Community First Choices program receives support coordination. So I'm going to take these next few slides together and just mention that here are some ways that we work with our managed care organizations to ensure that support coordinators are really prepared to advance person-centered approaches to this work. So on this first slide, we're noting just some of the key principles that we want to see with respect to support coordination. So leveraging strengths, identifying opportunities for community involvement, upholding the person's wishes and preferences, focusing on integrated employment opportunities and how a person can achieve his or her own goals. Going to the next slide. Noting, this is just a sample, training requirements for the support coordinator. Again, this is us working in partnership with our managed care organizations and taking into account and carefully incorporating into our expectations the feedback that we hear from our stakeholder community. So ensuring that the support coordinator is trained in person-centered thinking, planning, understanding strengths, the home and community-based settings rule, and related concepts around choice and control, supported decision-making, and I should note this is another way that the council, the department, and Gen Care partner together to advance supported decision-making opportunities. Going to the next slide, the support coordinator, the training really incorporates robust content around understanding conservatorships, and again, including supported decision-making options that I just mentioned. The training also ensures a strong foundation, going to the next slide, in behavioral health supports, behavioral health challenges, including a proactive, empowered system of support to address the person and the family's needs in an empowered way. And then going to the last slide here, my last slide before we turn to Clancy. Employment and Community First Choices also includes service options to empower people and families, which really underscores so many of the initiatives and the goals for the program that we've talked about today. A person's ability to advocate for himself or herself is essential to driving the person-centered planning process, that even the meeting itself and the conversations in the person-centered planning meeting. It's essential to seeking and gaining employment, to pursuing higher education. So you'll see here a sample of the supports that's included as a part of Employment and Community First Choices, including peer-to-peer support and navigation, and also family-to-family support. So I'm going to turn now to Clancy. Hi, Clancy.
Hi, Stephanie. How are you?
I'm great. How are you?
Doing great. Thank you so much for inviting me. I'm very honored to be here.
We are so honored to have you here. So we were just talking about self-advocacy and empowerment. And kind of on that note, we're so excited you're able to join us today and share your perspective as a self-advocate, as a person who's taking part in the Employment and Community First Choices program, and also a leader who serves with the DD Council. And I believe you're joining us from the DD Council office today. Is that right?
Yes, ma'am, that is correct.
Wonderful. So, Clancy, what would you like to tell this audience about yourself?
Yeah, so I moved to Tennessee in 2013 from Florida. I'm originally from Kentucky. I'll be turning 31 in April, and I'm very involved in a lot of activities. I sing on my praise team at church. I love being outdoors when it's sunny and being active outside, kayaking, boating, all those typical fun summer things that we all look forward to and enjoy.
Wonderful. I share some of the same interests. So tell us a little more about how long have you been a part of the Employment and Community First Choices program, and if you can tell us anything about how this program has helped you with some of the goals you shared with me, like getting a job and living in your own apartment.
Yeah, absolutely. So I've been a part of the ECF program for almost 3 years now. I started back in June of 2017, and ECF has primarily helped me live on my own through independent living skills. I currently live with 2 roommates in Lebanon, Tennessee through Prospect, which is an agency that has a residential program. But I'm very excited to say that in March I will be getting my very first place of my own, so I'm very thrilled for that.
Wow, congratulations. That's really exciting. Congrats on that.
Thank you so much.
So, tell me a little bit more about how being a self-advocate has helped you with meeting these goals too.
Yeah, so I think it's just really, it's really given me a voice to be able to speak for myself and what I want out of life. I definitely feel more confident about what I want out of life, especially since I've lived on my own. I've learned a lot about myself, which is a really good thing to be able to experience. And yes, I'm just very thankful for having Williams syndrome and just for the ability to use it for me to be successful in life.
And then tell us a little bit more about your role with the council, and particularly for people with disabilities to have these leadership roles.
Yeah, absolutely. So I've been on the Tennessee Council on Developmental Disabilities for going on 4 years now. It's hard to believe. It's gone by very fast. But I've had a lot of incredible opportunities through being on the Council on Developmental Disabilities. And I'm so thankful you brought up supported decision making, because that's one of those things that's very close, near and dear to my heart. In 2017, I testified to the Senate Judiciary Committee on the importance of supported decision making and why we need to reserve conservatorship for those individuals who truly do need it.
Oh, that's such an amazing perspective and story to share, Clancy. That truly is remarkable, and really shows the impact that you're having on people that take part in these programs, other people with disabilities, and you know, just thank you so much for sharing that. So let me ask you about your dreams for the future. Do you see politics in your future, just given what you're saying, or is it going to be Clancy in 2020, or?
Well, back to your question about folks with disabilities and leadership roles, I think that was your next question. I think it's very important for people with disabilities to have leadership roles, primarily because it eliminates the stigma of their incapabilities and really showcases what people with disabilities are able to do. And so I think that's absolutely wonderful. As far as my future goes, I see myself living independently and hopefully eventually working for a disability agency where I can really just change the view of people on disabilities in our society, and maybe even eventually start a nonprofit as well.
Wonderful. That sounds like you sound like somebody that we want to definitely stay in touch with. You've got a lot of successes in front of you, so we're definitely going to keep our eye on you. So tell us, what would you tell other states about creating programs for people with disabilities? We have a lot of people who have tuned in to listen to the webinar today. We heard from the poll that there are states and other organizations, advocacy groups, a lot of folks, a lot of different perspectives listening today. What would you tell everyone about creating programs?
I think it's highly essential for states to create programs for individuals with disabilities because we want to be a part of society. There's no need in us being left out. We are just as important as the other people who don't have disabilities, and our voice does matter, and we are as much part of the future as those folks are, and we have the same dreams and aspirations that they do.
Wonderful, thank you. And then last question there, What role should these agencies play in helping people to build their self-advocacy skills?
Well, I think it's crucial to the individual with a disability. I think it's crucial to their well-being to know that they can be a self-advocate. I think a lot of times people with disabilities aren't told that they are able to be self-advocates, or they don't know that that's even a possibility for them. And so I think it's highly important that they are told that they have value and that they can be a self-advocate and they have a lot to bring to the table.
Wonderful. Thank you so much. Is there anything else that you want to share today?
No, I think I'm good. Just thank you so much again for this opportunity, and I look forward to staying connected and working close again in the future.
Thank you so much, Quincy. We look forward to the same thing.
Thank you.
So going on to the next slide, I'm going to transition, Patty, back to you for any takeaways for the audience or guiding principles or themes that have been instrumental in shaping this work.
Great. I'm literally going to take 30 seconds because I want to be sure that we have time for a couple of questions. And honestly, I think after hearing from both Clancy and Gina, anything that I'm going to say has the point has been made by just hearing them speak about how important that engagement is in designing effective programs. It's important early as you're designing. It's important ongoing to really understand what is and what isn't working and how to continue to make things better. A part of what we have a responsibility to do is to support people in developing those self-advocacy skills in a number of different ways, whether it's through person-centered planning or planning together initiatives, or whether it is through actual services that allow them to go out and pursue different kinds of self-advocacy development. All of those things are about really equipping people to be leaders in our system and to really help inform the work that we do. And I want to reiterate again one more time that the things that we've talked about today, while we've talked about them in the context of a program for people with intellectual and developmental disabilities, are really applicable across long-term services and supports and across all of the different people who might utilize our services, that they all need to have a voice, and that voice is really key to making sure that our policies and programs are responsive to the things that will allow them to live the lives that they want to live. And so with that, I will turn it back to our moderators for a few brief questions.
Great. Well, thank you, Patty, and all the presenters for this presentation, which has been illuminating. We have gotten more questions in chat than we will have time to get to today, but I noted them all down, and we'll see what we can do to get some of these questions that we're not able to get to perhaps answered in writing and posted on ncaps.ecl.gov/webinars, along with the other resources that'll go with this webinar in the next few weeks. We've got a couple of questions from the audience around barriers to supporting people to move into employment. So I think I'll just try to cover a number of those and ask, where has Tennessee struggled and where has Tennessee had success with moving people into community employment? What are some key factors, maybe some struggles and also some successes to note here?
Sure, this is Patty. I'll start. I would invite Jordan and others to weigh in as well. I think one of the biggest challenges that we consistently see is really just around expectations. And it's both the expectations that people have of themselves based on what they've oftentimes been told, and expectations that families have around what their family member may be capable of, again, based on things that they've been told over the years. And so many people come into the program with a mindset that I can't work or my son or daughter can't work. The biggest part of our challenge is really finding opportunity to change those expectations and to help people see what is possible and how it might be possible. The other one, and you've heard us talk a lot about this, is just the continued transformation of our service delivery system. to really think about employment in an individualized way. So it's not just about helping people work, it's about helping them find meaningful work that aligns with their skills and interests and things that they really have to contribute and want to contribute in a work setting. So that takes a different kind of skill set, right, to do that sort of individualized planning, that individualized job and skill development with people that allows them to be successful. And I think we've both struggled and we've also had tremendous success as we've continued to work in both of those areas. I think our employment-informed choice process, which includes an exploration service, but it also includes a benefits counseling component where we can begin to answer some of those questions and concerns that people have, along with providing individualized opportunities to actually understand what work might feel like, look like to you, and things that interest you have really helped us to overcome some of those barriers. Jordan, do you have more to add to that?
Just real quick, two things that I certainly, everything Patty said is what I would have indicated also. One of the things that made a really significant impact for us when we're talking about successes was documentation of those successful engagements by virtue of video. So our communication department here and our executive leadership in general made a real commitment, both financially but also creatively, to document success stories in a different way. It's, you know, for someone like me who's been having that conversation Patty was referencing with families for decades, I underestimated significantly the value and the impact of today's modes of communication, social communication platforms, and video documentation. So in a couple of 15, 20-second, 30-second spots, we were able to reach an entirely new audience, and that audience was able to reach mom or dad or their provider or someone close to them to say, hey, I just saw this person and I can do that. I know I can do that. And so I would tell states, do not miss that opportunity, and certainly do not undervalue that impact. It has been transformative in our system. The other thing I'll say is going to sound much more bureaucratic than I ever hoped to become, but here I am. Don't be afraid to regulate mandatory outreach or mandatory engagement at some level. Obviously, all services are by virtue of request, but one of the things that we did that helped was by forcing that conversation. Patty referenced, I think early on, by forcing people at least annually to have an informed conversation about employment options and integrated support options, even if that answer from the family was no, we're not interested, making those decisions in an informed environment and equipping case managers to have conversations and provide options, I think has helped kind of grease the wheel with some of those typical immediate no responses, my son, daughter, friend, or other can't do that. And so those two opportunities are right there for the taking for everybody, and I would encourage everyone to take advantage of them.
Great. Well, thank you, Jordan. And I wish we could talk more, but we are already a couple minutes over. If we could just go to the next slide, Connor. One quick reminder before we go, please join us next month for a webinar featuring speakers from Australia, New Zealand, and Canada, focused on family-to-family supports for parents with of young children with disabilities. We're really excited about that one. You can register on our website. And then finally, I'd like to just pull up a few evaluation questions. If folks could just click through these questions and let us know how we did with this evaluation before you sign off. We do use this information to continue to improve NCAP's webinars going forward. And we'll leave this evaluation poll up for a few more minutes. In the meantime, I want to extend a warm thanks to all of our speakers today for this great information. We're honored to have you be part of this NCAPS project. And I hope that everyone here stays tuned for future NCAPS webinars, and we will see you again. Take care, everyone.